Hi everyone, I'm Dr. Georgine Nanos from Kind Health Group, and I'm here today to tell you a little bit about what's going on with the coronavirus. I've had so many questions that I thought I'd put together a little video to help everyone out. So I'm a family physician and I'm also an expert in epidemiology and public health. I have another degree in that field, which is the spread of diseases. So I know a little bit about this stuff, so I thought I'd share what I know and what we know so far about the coronavirus. So first thing, don't panic. The news media is doing a really good job at racking up their ratings and creating a really serious panic. The coronavirus is a virus that's very similar to influenza, maybe even less virulent or potent, as strong as influenza or the flu. The only difference is it's a new virus, a novel virus, COVID-19, and it is not something that any of us have ever seen before, so we don't have any immunity to it and we don't have a vaccine for it. To put it in perspective, influenza occurs every year throughout the world, and usually there are about 600,000 deaths annually from influenza every single year. There are about 3 to 5 million cases worldwide of influenza every single year. And in the United States alone, 50 to 80,000 people die of influenza, the flu, every single year. By contrast, coronavirus now has killed 3,000 people worldwide. It's very sad for those 3,000 people, but as you can see, to put it in perspective, this is not something that's quite as scary as influenza, and considering that we even have a vaccine for influenza. So my point again is, don't panic. Most people who are healthy are not going to have serious complications from coronavirus. And yes, a lot of people will probably get it and it's going to be okay. It's going to feel like another cold virus, flu-like condition. And the best thing to do if you are having these symptoms is to stay home, treat it as you would any cold or virus, and make sure that you're not exposing yourself to others. So this virus is spread through respiratory droplets. So if someone coughs on a surface or into their hand and then shakes your hand and then you touch your face, that's how you can get this particular virus, the coronavirus. What I don't recommend is wearing masks unless you actually are sick. If you're sick, then you should wear a mask, but in that case, you really shouldn't even be outside or among other people. You should just stay home and isolate yourself until you are no longer contagious. So the masks really are of no use. The most important thing you can do is wash your hands for at least 30 seconds in warm soapy water thoroughly, and then dry them with a paper towel or a clean towel, not a cloth that everyone's using. Or an air dryer. If you don't have access to warm soapy water, use a hand sanitizer. At every occasion, you want to make sure your hands are clean, especially before eating and touching your face. So what we don't realize is we touch our face about 200 times a day or more, and it's just an unconscious thing that we all do. So one thing we can also do is be really mindful of when we're touching our face and try to reduce the number of times that we do that throughout the day. The last thing is to wipe down our surfaces that you touch frequently, because the virus can live on a surface for a period of time. We actually don't know how long it can live at this point, and there are kind of a variety of estimates as to how long. So you want to wash down commonly used surfaces. If you're touching a door handle, you want to make sure you're washing your hands after that, or elevator buttons. And then the most important thing is washing down our phones. Our phones are the dirtiest things we have in our possession. They're 7 to 8 times dirtier than a toilet. So these are all things we should be doing all the time, but at this point, they're especially critical. So that's all I have for you guys. I can provide more updates as we have more information if you found this useful. And thanks, and have a great weekend.